and then back to itself so that it holds the tubing securely, but it's going to keep it from digging into the patient's leg. And I'm going to take this across the other piece of tape that's on there. And that way there's some play in this so that it can be a little freer for the patient. Now noticing that where I have it taped is pulling kind of a little bit here, so I'm going to have to readjust that a little bit and bring it up. So my first piece of tape is a little bit low. And so now, I'm going to now know that I have enough area here so that it's not going to pull too tightly. And at this point, I can take off the kit and clean off this off the bed. If there were any baby down in here or anything, at this point, it should be on my drapes. I'll be able to remove this, put the patient's other leg down, and then I want to make for sure also not only to cover the patient for warmth and for privacy, but to make sure that there are no dependent loops hanging to where this will loop back around and stop draining correctly. And so I want to, now that I've got it set on the patient's leg, I want to come back and make sure that if I have any loops, they're looped up here on the bed and they're not hanging down. Now, in actual hospital beds, you may be hanging this way down on a lower area like this. But on this, we have to work with the stretcher that we have, and so you'll see that I've hung it way down on the side, and also that I have used a little rubber band and the tubing guard right here to be able to keep any loop right up here on the stretcher itself. And so I'm just clipping that to the sheet, and that way it'll keep it from having a dependent loop hanging down. All right, Ms. Doe, you've done very well, and I'll be back on later to empty that, and we'll get you ready for some other things. Thank you very much.
Yeah, I'm going to take some over into the
Nurse session, and I'm looking up the orders. Okay, so I have to reach in.
there again. I would be doing all the checking and everything.
Okay. And now I'm going to go ahead and pull you down back to expose the lower area. And I'm going to go ahead and wash my hands and get ready to reach in and pull out the sterile gloves. Which I'll go to the side. And also I'm going to reach over and pick up just the outside edge of my drape. And in this case, my underpad, I can use this or I can dispense with it, and I'm going to choose to dispense with it under the out of this situation. Now, I'm go ahead and put my sterile gloves on. But before I do, I'm going to move my entire box over here so that it's close to where I'm going to need it. I've got this set off on my back, I don't need my seals at all. And now I'm going to step back and put on my sterile gloves. things in my hip, and as in the other demonstration, I do have the iodine sticks, in this case, that have been dried out, and that's what we have to use on the mannequin. We also, this is how yours should probably be, bigger alcohol or iodine swabs that will be in a package like this, so you need to open them and allow them to dry before your checkout. Or iodine solution can be put on the cotton balls, and if we did that, then we could there again use this and use it to clean the meatus. Now, I'm not going to do that either. I'm going to put this to where I can get to all of my sterile pieces. I'm going to rearrange things just a little bit. And I'm there again going to put this over here in the side of my box. And the KY jelly that's here, just look and see what all of my contents are. This one is my water, and I'm going to, here again, take the top off this and make for sure that I have all of my air out of it. And I'm going to attach it and look at my balloon as I inflate it and make for sure that there are no splits or cracks anywhere. And I'm going to let the water run back in this, and I can help it a little. I can pull it back. Just need to make for sure that when you get done with this and you look at it, that you have no bubble here at all, so that it will go in smoothly into the urethra without causing any trauma. So I'm going to just lay my catheter here in the box so that it will stay sterile. And now, with the male, I'm going to pull back the foreskin if there is one. If there's not, then I won't have to do that. I'll reach over and get one swab, and I'm going to go all the way down with one circular motion, and then again all the way around the meatus with one circular motion, and the last one the same thing, one circular motion, never lifting it off the skin until I get to the end, and then put that there. Okay, the next thing that I'll be doing is taking the KY jelly, and I know you may not be able to see that this syringe is actually full of air because we can't put the actual KY into the mannequins. So you would, in real life, you would have your KY jelly and you would take it and put it in the meatus, and you would insert the entire amount for lubrication and then dispense with that. And now I'm just going to pick my box up and move it up, because that way I'm not dragging my catheter over all of this area. And so I'm going to make sure that I keep the catheter itself sterile, and I'm going to insert it into the meatus. And at this point, for the male, you insert it all the way to the bifurcation or the Y area of the catheter. And that will be all the way up till you get it to where the catheter splits. Now I'm going to inject all of the water. So it should be well up into the bladder, up through the complete urethra. And I'm going to hold the plunger to the syringe, and I'm also holding the catheter with my non-sterile hand as I pull back. And now you see I've pulled out this far, but it's tugging, it's giving me resistance. So at this point in time, I know that the bulb is seated in the bladder. I've continued to hold pressure here so I don't have any backflow of water coming back into my syringe. And while I'm still holding pressure, I'm going to disconnect that. And now everything is done except for putting the tape on the side. to be able to hold the bag. So I'm going to go ahead. At this point, it is now a clean procedure rather than sterile. And so I'm going to put some tape on the inside of the thigh here. So, kind of high. And because you may need to reuse your equipment, I would suggest that you just fold up your bag and just slip it back through the hole in your drape. In real life, what we do is we would just tear that drape because we're not going to use it again on the other patient, but since you practice and you may have to keep yours. And at this point, we're going to get it to the point of seeing where the natural curvature of this catheter is and the tubing that's attached to it. And so right now, I'm going to go ahead and I'm going to put my tape right around the catheter itself. And I'm going to now take it to this. The reason why I put an extra piece of tape on the thigh is because especially in older patients, you will see that sometimes they have real frail skin and you need to adjust it. You sometimes do. If you take to the tape instead of continually taking it off their skin, it's easier on that area of skin. So you see now that there's some play in this, that it's, we do have it, where it's comfortable, it's not pulled real tight, and we don't want any dependent loops. We don't want to leave a tubing hanging way down, but we do want our catheter itself hanging usually down below the bed. Now, if you're having a hospital bed instead of a stretcher like I have a demonstration today, then you usually have a little hook down about this area that you can find. And so I would encourage you as you're practicing to go in the lab and get down on your knees and look under the bed and see where that is. And here again, the little blue tab here, you can use it to hold the tubing in place. You also, if you have to get a urine specimen and you have to stop the flow of the tubing out of this, you can put the clip on this like this, and the urine will only drain out to this point in area, and then you can come back up here, and right here on this little port, you can, depending on what type of port it is, it'll either be one you use a needle or don't use a needle, depending on what type of equipment you have. But you can insert either a needleless syringe or a syringe with a needle, depending on what type of set you have, and get your catheter specimen of urine that way. And then just make for sure that if you block off the catheter like that, never leave it for more than 30 minutes. Because then you'll end up with retention. You'll have catheter or urine flowing back instead of down into the catheter. It'll be flowing back into the bladder, and that can contribute to urine problems. Another thing that you can realize is if you don't have a hook or some structure like we have here to be able to put your hooks on here, because these are very rigid, the little rope that's back here at the back is very easy to take this and pull it up and make another little loop. And if you just have a little hook right here, you can hang it there like on an IV pole on the end of the stretcher or whatever. So get familiar with your equipment and different ways that you can use things so that you know what you're doing and you know you're comfortable about it. Okay, and at this point, we have Mr. Doug, your catheter done for you. So I'm going to just clean up all of the things.
Just I was talking about there, and I know I didn't realize in the thing, some of this you can see and some you can't. This is like a little clothespin type of thing that